everyone. It's me, Karli Burridge, founder and owner of Gaining Health, and we are back for another episode of What's Up Wednesday. I know I was gone last week. I decided to take my own advice after talking about vitamin D and head to the beach and get some vitamin D of my own. But we are back this week to discuss another study from the journal Obesity. And the journal article that we're talking about today is called Diagnosing Obesity as a First Step to Weight Loss, an Observational Study. So there were some big giants and the authors of this study, which included Debbie Horn, Bob Kushner, Tim Garvey, and some of the big giants in our obesity field. And what they did is they explored the relationship between the diagnosis of obesity and weight loss as a percent of total body weight loss over 9 to 15 months using EMR data of close to 700,000 patients at 15 different health systems. And they were looking at patients with BMIs greater or equal to 30. And what they found was that 45% of these patients with BMIs greater than or equal to 30 received the diagnosis of obesity. And so, first of all, we need to stop there for a second. Only 45% of people with the disease of obesity with a BMI over 30 were actually given the diagnosis of obesity. And this is actually even lower than what they found in the 2017 study, the ACTION study, where they reported that 55% of patients with BMIs greater than or equal to 30 received that diagnosis. So, I mean, can you think of any other disease state where only 45% of patients with this chronic condition are actually even receiving a diagnosis? So first of all, I just wanted to point that out that, we still have a long way to go. So 55% of these patients did not even receive the diagnosis of obesity, which is, again, a clinically recognized medical condition by the American Medical Association and the World Health Organization. The AMA has recognized obesity as a disease since 2013. So it's been a little while now. And for the World Health Organization, that was way after the World Health Organization recognized obesity as a disease. So anyway, in this study, they did control for potential confounding variables. And even when controlling for these variables, such as prescribing anti-obesity medications, which unfortunately was a pretty low number of providers who were prescribing. But so they looked at these other variables and they found that documentation of obesity still remained independently predictive of at least a 5% weight loss, suggesting that the documentation of the diagnosis of obesity may be an important step towards engaging patients in weight reduction. So again, why is this important? So we know that there's increasing recognition of obesity as a chronic disease by both patients and providers, but we still have a really long way to go as far as treating it as such, both on the provider side and the patient side. Providers feel like this is not something that they need to address, and patients feel like they are solely responsible for managing this condition on their own. And the COVID pandemic has really highlighted the importance of metabolic health, with obesity, hypertension, and type 2 diabetes being the most common comorbidities of patients who were hospitalized with COVID-19. So it's so important that we recognize and treat obesity as a chronic medical condition, because when we treat obesity, we are also treating the over 236 other medical conditions that are either caused by or exacerbated by obesity. It's so important to recognize for patients and providers that obesity is not a character flaw, it's not a personal choice, and it's so much more complicated than is implied even by some of the codes that we use. E66.0, that code is obesity due to excess calories, and that just simply does not describe the complexity of obesity. There is so much more to it. And so unfortunately, this bias and stigma that it's just a matter of excess calories or a calorie balance issue is unfortunately even baked into the diagnosis codes, which is why I prefer to use the code E66.9, which is obesity unspecified. So just a little tip there too. So this study supports what other studies have found, that making the diagnosis of obesity has an impact on how providers and patients view this serious and treatable medical condition, and that it actually has an impact on weight reduction. So we still have a long way to go, but if all of the healthcare providers just at least made the diagnosis of obesity, that's the first step. We need to make sure we're diagnosing it. And then the second step would be to actually schedule a follow-up appointment to address the obesity specifically. So if we did that, that would be a great start and would probably go a long way. So take home point is, if you're in healthcare, make sure that you're making the diagnosis of obesity and even pre-obesity. And if you are an obesity specialist like myself and you want to know where we can start to make a difference when we're talking with some of our primary care or other colleagues when it comes to treating obesity, I would say, let's start with making the recommendation for everybody to at least diagnose obesity, and let's start there. And hopefully that will get us going a little ways, because we have a long ways to go, but let's diagnose and schedule a follow-up. All right, so that's it for What's Up Wednesday for this week. Make sure, if you haven't subscribed yet, please go to gaininghealth.com to subscribe, so I can let you know about all the great resources that I'm creating with Gaining Health. We have the Developing Your Obesity Medicine Program book that's on the website. We have lots of other resources like templates, patient forms, letters, things like that on the website. We have resources for education on the website, and I'm developing a lot more material. If you have something that you think, gosh, this would really help me in my clinic when I'm treating patients with obesity or other metabolic conditions, please reach out to me. Let me know. If you have ideas, suggestions, reach out to me through the website. It's www.gaininghealth.com. And I hope to see you all next week for another episode of What's Up Wednesday. All right, take care. Bye.